Hi friends, in this series of fluid therapy, today I will talk about colloids. First is the disclaimer. Caring Dogs YouTube channel does not provide medical advice and information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided here is for educational purpose only and this information should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. There is no endorsement for any brand or a company. Friends, colloids are basically the mixtures of large molecules or particles that remain suspended in a liquid rather than dissolving like crystalloids. They are widely used as a replacement fluid as a replacement fluid for volume expansion of the plasma and hence they increases the cardiac output. Different colloids they vary in their molecular weight and therefore in the length of time they remain in the circulatory system. Because of this and their other characteristics, they may differ in their safety and efficacy. If we see the crystalloids, the colloids are very large molecules. They stay in the bloodstream and making them better at expanding the blood volume. But crystalloids, they are smaller molecules. They leak out of the bloodstream and hence they are less effective as a blood volume expander. So colloids are at least 3 times more effective than crystalloids at increasing the blood volume and supporting the heart functions. They serve as a life-saving agents in emergency situations like hemorrhagic shock when blood or plasma isn't available. But just remember that colloids, though they help in blood volume expansion, but they lack oxygen and hence besides expanding the blood or plasma volume, we must supplement the patient with blood transfusion as soon as possible because blood transfusion will maintain the oxygen supply to the patient. Different types of colloids which are available in the market are albumin, hydroxyethyl starch, gelatins, and dextrans. Albumin is derived from the human blood. It is a natural colloid that expands the blood volume and hence supports the cardiac output. Hydroxyethyl starch, it is a synthetic colloid made from the starch and it is used for the expansion of the blood volume. Gelatins, they are derived from the animal collagen. They are used as colloid in some countries. Dextrans are another synthetic colloids which are made from the glucose molecules and they are also used as a blood volume expander. Colloids work by expanding the blood volume. They increase the blood volume by drawing the fluid into the bloodstream. They help in supporting the cardiac output by expanding the blood volume. Colloids they help maintain cardiac output and blood pressure of the patient. They help in reducing the fluid shift. Since colloids help reduce fluid shift from the bloodstream to the tissue, so they also reduce the peripheral edema. Advantages of colloids are they act as a rapid volume expander. They expand the blood volume very quickly, making them useful in emergency situations. They have longer duration of actions. They remain in bloodstream for quite longer time as compared to crystalloids. Hence, they provide sustained volume expansion. The disadvantages of colloids are in some patient may feel allergic reactions because of colloids, particularly those colloids who are derived from the animal sources. Colloids can affect the blood clotting and they can increase the risk of bleeding in some patients. They are costly, they are more expensive than crystalloids. We use colloids in patients with hemorrhagic shocks. They are useful in emergency situation where rapid volume expansion is needed. We don't have a blood or plasma available at that time. We can transfuse the patient with colloids till the blood is available. In patients with sepsis, colloids may be used to support the cardiac output and maintain the blood pressure. Patients with burns, colloid can help manage fluid loss and hence support the cardiac output in burn patients. These are the few colloids which are available in the market. I have categorized them as per their plasma volume expansion and duration of expansion. The 5% albumin, it expands the plasma volume by 70 to 130 ml and its duration of expansion is 16 hours. Similarly, 25% albumin, it increases the plasma volume expansion by 400 to 500 ml and its duration of expansion is also same as that of albumin. 6% Hetastarch, it increases the plasma volume by 100 to 130 ml and its duration of action is 24 hours. 10% pentastarch, it increases the volume expansion by 150 ml and its duration of action is 8 hours. 10% dextran 40, it increases the volume expansion by 100 to 150 ml and its duration of expansion is 6 hours. Similarly, 6% dextran 70, it has duration of expansion as 12 hours but it increases the plasma volume by 80 ml. I will be discussing all these colloids one by one in my incoming videos. Dr. William J. Mayo has said that the greatest medicine of all is teaching people how not to need it. I hope you will like this video. Keep learning. Thank you very much.